Assalamu alaikum, dear students. Today we will study the anomalies of tooth which you may have observed in different teeth, and we have studied in individual teeth the anomaly of the related tooth. So today we will study the anomalies of teeth which occur most which is found most commonly in the population. As you all have studied the development of tooth, in which there is physiological stages of development and morphological stages of development. In the physiological stages of development, these are the stages which I have mentioned: the initiation, proliferation, histodifferentiation, morphodifferentiation, and apposition. In the initiation stage, there is uh, a formation of dental lamina, and tooth bud formation takes place through the mitotic division of the cells. And in the proliferation stage, it occurs through the mitotic division of cells, which pass through the cap stage and bell stage and influences the general size and shape of the tooth. There is cap stage, as you have studied the different structures appears, like enamel knot formation and enamel septum, and there is enamel nick formation. These stages occur in which the proliferation of cells takes place. So in the histodifferentiation stage, there is formation of emeloblast and odontoblast, which form the enamel and dentine of the cell. The cells become histodifferentiated into odontoblast and ameloblast. Okay? As you have all studied it, it forms the enamel of the tooth and it forms the dentine of the tooth. Okay? Then after that, the histodifferentiation and when the histodifferentiation takes place, the cell's mitotic division stops when the cells become differentiated. And then during the morphodifferentiation, there is cuspal morphology, and the shape of the tooth is determined. The crown form and the root form is determined. The shape of the tooth is determined, and the disturbance during this stage can result in the the uh, abnormality of the crown or root, right? In the apposition stage, there it follows after the root formation, in which there is lying down of regular dentine and cementum throughout the life. Okay? During the morphodifferentiation, the shape of the tooth is affected. The disturbance during the morphodifferentiation stage may result into the abnormal crown and root formation, but there will be no effect on the enamel and dentine tissue, calcified tissues, and the developmental disturbances may affect the size of the tooth, the number and the eruption timing of the tooth, and the shape and form of the tooth, and the defects of the enamel and dentine, which occurs through the histodifferentiation stage. And the size, which I have mentioned in the morphodifferentiation stage, the number and cusps of the crown and root morphology also occurs during the morphodifferentiation stage. The number and the eruption timings may occur during the cap stage, या फिर जब टूथ बड फॉर्मेशन होती है, if there is an accessory bud formation takes place, या tooth gem divides to form another tooth gem may affect the number of the teeth. And there are different causes which may affect the anomalies of the tooth, like if there are nutritional deficiencies, or there are metabolic disturbances going on. so they may affect the they may result in the anomaly of a tooth. There are certain environmental factors which may induce the trauma to the developing tooth bud, so it can result in the development, and it can result into the anomaly of a tooth. So these all are the factors. There are multiple factors. The etiology, the exact etiology of the anomaly is still debatable, but there are the developmental disturbance like shape and form which result from the morphodifferentiation stage. There could be the enamel and the dentine defects which occurs at the histodifferentiation stage. So these are the probable stages in which the anomaly of the tooth takes place. So there are different causes, or multiple factors are present, like genetic factor could be present which may result into the anomaly of a tooth. There are certain anomalies of the teeth which are associated with the syndromes, with the multiple anomalies in the body, like there is if there is ectodermal dysplasia, it may affect the enamel of the developing enamel of the teeth, and the enamel could be defective because of this the ectodermal dysplasia associated syndrome. Okay, fine. Now we will proceed. So there are, first we will study the abnormal number of the teeth, the anomalies which occur in the number of teeth, right? So there are anodontia in which there could be a partial anodontia, and there is complete anodontia. In complete anodontia, there is no tooth bud present. As you can see here, no tooth is present in the oral cavity. There is complete absence of the teeth. In the partial anodontia, there are less number of teeth are present. The partial anodontia could be of two types: the hypodontia, in which up to the sixth number of teeth are missing, and the oligodontia, in which more than six number of teeth are absent, right? Here you can see the hypodontia in this condition. The picture is showing the hypodontia in which less than six number of teeth are missing. The lateral incisors are missing over here, right? And there is a total lack of tooth development is called, as I have mentioned you, the anodontia. And if there is more than six number of teeth are missing, then we call the condition oligodontia, right? Understood? In hypodontia, the most commonly missing permanent tooth is the third molar. Almost the 25% of the human population is having missing third molars. After that, there are commonly missing teeth are the lateral incisor and mandibular second premolar. The least commonly missing tooth is canine, and it is the stable tooth in the oral cavity. It is least commonly missing tooth. The hypodontia is also considered to be as an evolutionary changes, as the people are having commonly having the missing third molars, as we are more moving towards the refined diet, and the teeth are less required to chew such refined food. So the evolutionary point could be a factor of missing these teeth. But most commonly we come across with impaction of the third molar and missing, and it could be a missing tooth in the oral cavity. The hypodontia are rarely seen in primary dentition, could be present, but it is least commonly present in the primary dentition. Now we come towards the supernumerary teeth. As you can see, there is an anterior tooth present between these incisors, the maxillary incisors here. This tooth is an accessory tooth which is called as supernumerary tooth, which is present in the between these incisors in the anterior teeth, and there could be an extra molar or the fourth molar be present on the posterior surface of the on the posterior aspect of the teeth with the third molars, and that fourth molar is called as the supernumerary molar or the paramolars, right? And These mesoidents you may have come across in your clinical rotation. You may see this tooth, and this patient comes with an aesthetic complaint for this mesoidents, and this mesoidents is not acceptable by the patient from the aesthetic point of view, and they want to extract this tooth in the surgery department, right? So now we will move towards the other anomalies of the. There is now we will study the abnormal size of the tooth. There could be a microdontia present or the macrodontia present. You can see here there is a macrodontia present. The large size of the tooth is present in these incisors relative to the other tooth. So this condition is called localized macrodontia, in which there is a larger teeth are present as compared to other teeth. This condition is known as the generalized macrodontia. ठीक है? There when there is a growth hormone anomaly, the teeth and there is a general increase in the size and shape of the body, the teeth size of the teeth will also be increased, and this condition is called as true macrodontia. The relative macrodontia means there could be a localized anomaly present in which in which there could be increase in the size and shape of the tooth, but only focus to one or two teeth, right? And there could be false macrodontia. Macrodontia means that there could be the smaller jaw, or the thickness of the jaw is small, but the size of the teeth are large, so we call it a false macrodontia. In the true macrodontia, there could be a hormonal defect, and in the relative or the false macrodontia, there could be the size effect, size and shape of the teeth are larger, right? In the in the microdontia, there could be it also could be relative or generalized. In the microdontia, there, like you may have seen the dwarf people. In the dwarf people, there is a general decreased size and shape of the tooth, and that is called as true microdontia. And in the relative microdontia, the size of the individual teeth, right, like one or two teeth is smaller than the other teeth. And the false microdontia, in which there is jaw size or the bone size is larger than the size and shape of the teeth, right? Now we come towards now we come towards the abnormal shape of the tooth, the taurodontism, in which there is the abnormality of the shape of the crown. The crown is larger than the root of the tooth. There is dilaceration, in which there is a defect in the alignment of the crown and teeth. The dilaceration, they deviate from their linear relationship. The cause could be the trauma or pressure exerted on the developing tooth, which deviate it from their linear relationship. There is flexion, in which there is only the abnormal bend is present in the root of the tooth, which can be only counted when there is a sharp bend present in the root of the tooth. The gemination is an anomaly which occurs when the tooth wants to divide itself, but the division doesn't take place completely. The twinning occurs when the gemination is complete, and there is two identical teeth present in the oral cavity. The fusion occurs when the two tooth germs fuse together and they form a single tooth, and there is decreased number of teeth in the oral cavity. In the gemination, there will not be a decrease in the number of the teeth. Okay? And the concretion, and in the twinning, there will be an increased number of teeth present. The concretions occurs when only the root of the teeth become fused together. The dwarfed roots is the anomaly, in which there is short roots are present as compared to the crown of the teeth. Most commonly occurs in anterior teeth, in which there is more convexity present on the labial surface of the teeth, and the roots are short. ठीक है. The hypercementosis occurs as a result of trauma in the root of the teeth, and there's excessive cementum formation takes place in the root of the teeth. आपने इसको cementum के उसमें पढ़ा होगा चैप्टर में कि there is hypercementosis occurs as a result of trauma. जैसे कि अक्सर ऑर्थोडोंटिक ट्रीटमेंट में ऐसा होता है कि प्रेशर ज़्यादा अप्लाई कर देते हैं और उसकी वजह से हाइपरसेमेंटोसिस हो जाती है. अदरवाइज नॉर्मल कंडीशन में हाइपरसेमेंटोसिस नहीं होती है. तो अगर आप ऑर्थोडोंटिक में भी एक लेवल का जो है एक डिक्रीज लेवल के फोर्सेस अप्लाई करो तो उसमें भी हाइपरसेमेंटोसिस नहीं होगी. हाइपरसेमेंटोसिस तभी होगी जबकि रूट को ट्रॉमा मिलेगा. ठीक है. एसेसरी कस्प एंड द रूट्स कैन बी फॉर्म्ड एज अ रिजल्ट ऑफ द एसेसरी कस्प एंड रूट्स, जबकि हार्टविक एपिथेलियल रूट शीट में, जैसे कि आप लोगों ने पढ़ा था रूट के डेवलपमेंट में, हार्टविक एपिथेलियल रूट शीट में कोई एनॉमली हो गई या फिर उसमें एक एसेसरी वो बन गया रूट के लिए, एक एसेसरी फॉर्मेशन की वो लूप बन गया, तो उसमें फिर एक एसेसरी रूट बनेगा. एसेसरी कस्प इज अ रिजल्ट ऑफ द morphological stage and it occurs when there is a accessory cusp. किस में होता है? ज़्यादातर हमारे पास posterior टीथ में एसेसरी कस्प बनेगा और एंटीरियर लिंगुअल के ऊपर जो है लिंगुअल सिंगुलम के ऊपर एक जो है वो आउटग्रोथ सी बन जाएगी. तो इसे हम कहते हैं एसेसरी कस्प फॉर्मेशन, जैसे कि टेलॉन्स कस्प है. ठीक है, जो एंटीरियर टीथ में होता है. ओके. Here you can see these different anomalies. I show you. यहाँ पर जो है हम देखते हैं there is flexion present in which there is a sharp bend in the roots of the tooth. Here you can see bend is present, the curvature is sharp, and they are abnormally curved over here, right? And the crown is normal. In the dilaceration, there is deviation from their linear relationship. Both crown and root are deviated from their linear relationship, right? In concrescence, there is fusion of the roots of the teeth. So while extraction, and they may cause difficulty in the extraction of the teeth. In the fusion, we can see the two jump fuse together. ठीक है, and there is a decreased number of teeth present in the oral cavity. In the dwarf root, we have larger number of crown and the short roots are present. Accessory roots is a developmental anomaly during the development of root, and there could be an accessory root present over here, and you can see as in the molar. The accessory roots are commonly present in the third molars, as I have told you. थर्ड मोलर में ज़्यादातर एसेसरी रूट्स पाई जाती हैं, एंड देयर इज could be accessory canals present, and there could be an accessory which is also a defect in the formation of the root. The hypercementosis is also an anomaly of the root which occurs from the constant trauma, or there is an injury towards on the root, and which form the hypercementosis. ठीक है, इसका कोई स्पेशल नाम भी था सेमेंटम के चैप्टर में. इसे हम क्या कहते हैं? एनाटॉमिकल रिपेयर और जो फंक्शनल रिपेयर आप लोगों ने पढ़ा था. ठीक है, और इसका एक और कोई स्पेशल नाम था, वो आप लोग सर्च करके मुझे बताओ कि सेमेंटम में क्या नाम था इसका. एंड देयर आर एनामल पर्ल्स प्रेजेंट विच इज अ एनॉमली अकर. Here you can see the taurodontism, in which there is a large number of large size of crown is present over here. In the radiograph you can see there is large pulp cavity present, and there is short crowns, short root are present as compared to this crown. So we can see, we also see here the flexion in which there is sharp bend in the root of the teeth are present, right? Now we will discuss the gemination and the fusion. In the gemination stage, as you can see here, there is division of a single tooth germ. When the single tooth germ begins to divide, there may be a notch present between the two teeth. It tries to divide, and the division is incomplete, and there is slight ditch over here. And you can see the dental incisor is present and the canine are present. It mostly occurs in the mandibular incisors and in the maxillary incisors, and they have a single pulp cavity, and there is no increase in the number of the teeth, but the mesiodistal width of the tooth is greater as compared to the normal one, right? Here I will tell you the difference between the fusion and the gemination. In the fusion, the two tooth gems fuse together. It mostly occurs in the anterior teeth, where it has two pulp canals and two pulp chambers are present over here. Two pulp canals are present and the two pulp chambers of the tooth gems are present over here. ठीक है? And gemination में क्या होता है? It has got a single heart, a single pulp chamber and a single pulp canal, but the mesiodistal width of the crown is increased. There could be a gemination. In case of gemination, there could be crowding result. ठीक है? जब साइज इंक्रीज हो जाएगा तो क्राउडिंग होगी, जबकि फ्यूजन में क्या होगा? स्पेसिंग हो जाएगी. नंबर तो डिक्रीज हो गया, लेकिन यहाँ पर क्या होगा कि जो स्पेस है वो ज़्यादा हो जाएगी. वहाँ पर स्पेस कम हो जाएगी और यहाँ पर स्पेस जो है वो ज़्यादा हो जाएगी. ठीक है? सो there is difference. They have single pulp chambers. Gemination and fusion, there could be a ditch present. When the gemination becomes complete, like if it divides completely into two teeth, so there would be, the condition is called as twinning. Then क्या होता है कि उसमें दो पल्प चैम्बर और कैनाल्स आ जाते हैं, और there would be increase in the number of teeth, and the twinning is the results in case of the complete gemination. And in the fusion, there would be a decreased number of teeth, there would be no increase in the number of teeth, and the fusion will result, right? Here we see the concrescence. In the concrescence, what happens? There is only fusion of root occurs, and there is a difficulty in the extraction of teeth. ठीक है? And there is you must have understood the difference between the concrescence, fusion and gemination. Understand? Here you can see the difference between the gemination, fusion and concrescence. Here you can see this is the gemination, this is the fusion, and this is the concrescence. I hope you all have understood the difference between the three. Understand? Now this is an example of enamel pearl, in which you can see there is a nodule present in the furcation area of the teeth. This is an enamel pearl on an extracted tooth, which is formed, which is an anomaly of Hartwig epithelial root sheet, where the enamel droplets are formed and they engage themselves in the furcation point of the teeth. This is most commonly present in multi-rooted teeth, where the furcation area is present. It is least common in the anterior teeth, but in the posterior teeth it is present, and they may predispose the periodontal diseases in the posterior teeth. It is found to be present in almost 2% of the population, and the enamel pearls is the anomaly which is most commonly found in the multi-rooted teeth. Now we will study the accessory cusps and root which is found in the teeth. The accessory cusp is a morphological anomaly in which there could be accessory cusp present, as I have taught you the talons cusp. The talons cusp is an example of accessory cusp which is present on the lingual surface of the anterior teeth, and just with the cingulum, the talons cusps are present as a outgrowth or tubercle on the lingual surface of the anterior teeth. The accessory roots are present in the it is most commonly found in the multi-rooted teeth, and these are the accessory roots and cusps are most commonly found in the third molar. The accessory cusp, when it is found in the molars, there is an example, that is mulberry molar, in which or the tubercles present on the occlusal surface of the molars are counted as an accessory cusp on the occlusal table. And these accessory roots is an anomaly of the Hartwig epithelial root sheath where baby and accessory root can be formed, and it is most commonly present in the third molar. The dense indent and the dense invaginatus I will show you in the later slide, and these are the anomalies of enamel organ. Enamel organ, ठीक है? Organ, ठीक है? And now we'll proceed. This is a hesitant anomaly of the crown of the teeth, in which there is it is an anomaly of bacteria Treponema pallidum, and it is most commonly present in the anterior teeth. In the posterior teeth, these Treponema pallidum, this is a screwdriver notched shape of anterior crown, which is present because of this congenital syphilis, and this congenital syphilis is caused by the bacteria known as Treponema pallidum, and in the molar, this condition cause a mulberry molar. A mulberry type of molar is seen in the posterior teeth because of this congenital syphilis. This is now dense indent, which I have shown you. It is an invagination of enamel organ. Enamel and dentine become reversed in the pulp cavity, and we can see the enamel tooth within a tooth. It gives the appearance of tooth within a tooth, and this you can see this invagination of enamel organ takes place, right? So it gives the appearance of tooth within a tooth. Okay, this is dense invaginatus and this is dense evaginatus. Accessory cusp or accessory tubercles are caused because of this accessory and this extension of enamel organ. This is dense evagination, where there is an invagination of enamel organ, and there is dense evaginatus, in which there is extension of enamel organ over the tooth surface, and it gives the a tubercle like structure over the tooth surface. And these dense invaginatus or the dense talons cusp is also an example of dense invaginatus. Okay, this is talons cusp dense invaginatus, which gives the appearance of a tubercle over the tooth. This is a lung premolar. It is clinically as an accessory cusp or globule present. Here you can see globule is present, located on the occlusal surface between the buccal and lingual cusps of the premolar. Right? Understood? So this is a talons cusp showing on the lingual surface of the anterior teeth, and the dense indent where the enamel organ invade in towards the inner sides, and the tooth gives an appearance of tooth within a tooth. It may leave a pit over the surface of the tooth, a lingual pit over the surface of the tooth where the caries may get the chance to grow over that pit area, right? It could be a home of the bacteria to get stagnate that surface, right? So this is talons cusp. So this is an example of dwarf fruits in which the crown portion is large and the root portion is small. This could be an hereditary anomaly, and here you can see here you can see the convexity is present over the root surface, and the condition could be bilateral. Most commonly it is present in the incisors, and they may be due to the passive eruption, and they may lost earlier than their expected time, and the resorption could take place. They may also be a reason of periodontal diseases. They may be a predisposing factor to the periodontal diseases. And there is the crown portion is short, and the crown portion is larger, and the root portion is short. Okay. So this was all about today presentation. I hope you all understood the presentation, and you will do the assignment. Plus say I don't want to see any cheated work. Otherwise this time I will fine you, and I will send your name through the SAS to make you find this time. Okay. So be attentive to the class. All the stuff you have in the presentation, you just have to tick it out and do the assignment. Okay. Best of luck all of you. Take care. Khuda Hafiz.